So our next speaker, and we're going to move in from what we've been talking into architecture, right? Global systems. Dr. Gladys Chesumbai from Kenya, the National Institute of Kenya, and IARC, walks us through the global blueprint where structure makes strategy and building equitable, inclusive registries. Hi, everyone. Hello, and welcome to this special spotlight interview for the 2025 Global Colon Cancer Conference. I'm honored to be joined today by a true trailblazer in cancer surveillance and registry development, Gladys Chesumbai. Ms. Chesumbai is the head of the National Cancer Registry at the National Cancer Institute of Kenya and a global certified cancer registrar with more than 18 years of experience. She has played a pivotal role in strengthening cancer surveillance across Kenya and sub-Saharan Africa, not just through technology and systems, but through mentorship, regional capacity building, and global collaboration. She also serves as co-PI investigator for global initiatives for cancer registry development under the International Agency for Research on Cancer. Today, we'll talk about her vision for equitable cancer data, her leadership on the front lines of surveillance and innovation, and how education like the new GICR e-learning series can change the future of global cancer equity. Good morning, good afternoon, good evening, and welcome, Ms. Chesumbai.
Thank you so much, Candace.
I'm
happy to be here.
Thank you. So I will start with the first question. That'll be, let's start with the big picture here. What are some of the most critical barriers you see when it comes to counting cancer patients in sub-Saharan Africa, especially in low-resource communities?
Well, the biggest of them all is government support. Most of the population-based cancer registries in sub-Saharan Africa are not under the government, under the ministries of health. So and even if there are, you find that their budget is quite low. So they would have just one or two staff running under them. So these are the staff who are expected to count all cancer cases in that population specifically. And this is a big challenge in terms of quality and in terms of completeness. The other challenge is poor quality infrastructure within the facilities. Most of the facilities in sub-Saharan Africa still utilize paper-based record-keeping practices. And as I said, the number of staff who need to go through all the cancer cases within the facilities are quite limited. So going through paper-based records is a huge challenge because keeping paper-based records requires space. It requires some sort of order, and this sometimes might lack in most of our facilities. So churning through all these paper-based records is a big challenge to cancer registries.
Wow. So, and we've heard this before, right? That there are some countries that are still, like I said, with medical records on paper, and so that causes a disconnect then, right, with the Ministry of Health and not being able to. So I imagine that impacts funding, correct, for infrastructure. Could you elaborate, like, how important is that, and how can something like that be advocated to change?
So I think for me to answer that, we need to look at it in a wider perspective. Cancer is just one disease in Africa. We have so many other health challenges, so many other challenges in general. So looking at cancer as a specific issue, I think it does not generally take up a lot of budget in terms of government budget. So we have to fight HIV, on which we are doing that quite well. We have to look at other diseases like non-communicable diseases and communicable diseases as well. So looking at cancer only as one of those non-communicable diseases becomes a challenge in terms of funding, because we also have quite limited funding to support the general health care and development in general in Africa. So yes, so that I think is the main issue, that there's limited resources, and these resources have to be spread across so many other needs in Africa.
So then is this kind of like how you hear there's some countries that rely on pathology-based registries? How is that different from, the other undercounting mechanism of collecting paper? So like, what are the challenges and the dangers of being undercounted and just utilizing pathology-based registries?
Well, thank you so much for that question. It's very important. We have different types of cancer registries. Pathology-based cancer registry is just one of those. So we have hospital-based registries, we have population-based cancer registries, we have pathology-based registries, and other special registries for specific diseases. So the hospital-based registries are registries that are found in the hospitals, where a health facility decides that they want to count all the cancer cases within that facility. And the population-based cancer registries is for a defined population. So if you're looking at a county or a district, a defined population that has boundaries, that is the population-based cancer registries. Pathology-based cancer registries are those cancers that are counted at the point of diagnosis. And this is pathology diagnosis. So when a patient is diagnosed through histology, through hematology, for example, that can be part of the pathology-based registry. The gold standard for cancer control and policy is the population-based cancer registries. So when you look at the population-based cancer registry, you can get all sorts of, it's a sample, it's an actual sample, because a hospital-based cancer registry, for example, people go to a particular facility for a particular reason. So if you just count for that particular facility, then it is not a true representation of cancer in that population. But a population-based cancer registry requires that the team under the population-based cancer registry goes not just to the pathology labs, not just to the hospital, but also to the radiology clinics, to the hospices, to the smaller facilities where any cancer patient would go. So it is a true representation, and also known as the gold standard for cancer control and prevention. So yes, having a pathology-based cancer registry is good, but it is not a true representation. In Africa, you find that not everyone will go to histology for diagnosis. You need to get a biopsy, you need surgery sometimes to get a sample from the body, but not everyone will afford to do that. Not everyone would want to do a surgery because of some myths and misconceptions. Not everyone would be, willing or able, or because of many challenges, including distance and things like that. So population-based cancer registry is a gold standard.
And that leads me to my next question, right? Because like you said, not everyone want to do that. Then how does this silence the voices of patients who are never recorded, right? Because that means that if it's just in one area and not the population base, that means that there are voices that are not going to be heard. How does that count as dignity if no one is being seen, right? That silence.
Yeah, so that's why we really recommend to have population-based cancer registries in each country. And because most people would say we have a hospital-based cancer registry, why do we need a population-based cancer registry? Because yes, it is a biased sample of the cancer patient in that region. So the voices that would likely be missed in a hospital setting would likely be captured in a fully resourced population-based cancer registry, because the basis of diagnosis that is considered in population-based cancer registries is not just pathology-based. Also the X-rays, also the MRIs, the radiological diagnosis, clinical diagnosis, where a patient might have a mass and the doctor knows that this mass is definitely a cancer, even though this patient would not end up having histology done. Those are also captured. So yeah, we recommend that government support population-based cancer registries to ensure that these voices are heard in the counting of cancer cases for each country.
Wow. So let's talk a little bit about policy and action and advocacy. So we know that good data doesn't just sit on a spreadsheet, right? It drives action. Can you share an example where like high quality registry data in Kenya or somewhere else that you may be aware of directly influences health policy or resource decision? Like how does having that high quality registry move the needle forward?
Thank you. So in Kenya, as an example, working as the head of the National Cancer Registry at the National Cancer Institute, good quality data really moves policy, because then the information that comes out of it is true and therefore verifiable and therefore impactful when used correctly. So for example, you find that in Kenya, we have 2 population-based cancer registries. Currently, we are in the process of establishing about 5 more to get a more representative picture of cancer in other areas, more arid and more coastal areas. So at the Eldoret Cancer Registry, where I worked for about 15 years, we have a population-based cancer registry there that is about 27 years old now. And one of the most common cancers there is cancer of the esophagus. Now, cancer of the esophagus is the most common cancer in general, but so we have also cancer of the prostate. We also have cancer of the cervix in female and breast also in female. But if you look at both sexes, cancer of the esophagus is the most common cancer. So one of the areas that policy has really supported, has really been actioned in this kind of area is that, and this you can see generally in Africa, is that based on this data from the Eldoret Cancer Registry, we were able to discover that this cancer of the esophagus is quite common, not just in Eldoret, in Kenya. It's also common in Uganda. It's also common in Tanzania. It's also common in Malawi, going down to South Africa, in Zimbabwe, and other countries along the Rift Valley belt. A lot of studies have come up out of this particular data to look at what exactly could be causing cancer of the esophagus in all these specific places. What is it? Is it what we eat? Do we all eat the same thing in Uganda, Kenya, Tanzania? Is it the soil? Is it something else? So in terms of just directing policy and directing resources, not just in Kenya, but also in IARC generally in terms of research, a lot of research has come out of data that is good quality from not just Eldoret, but other population-based cancer registries in Africa. So yeah, at the end of the day, the cancer patient of today or the cancer patient who has cancer of the esophagus tomorrow would be in a better place as compared to where they were 24 years ago.
Wow, that's amazing. And by having this data, it was kind of like a domino effect, right? Because it was like you uncovered one thing and then it led to something else that led to something else, and it's leading to improving, but also comparing information in other places where this is happening to see if there's some type of synergy, like, hey, so what's happening, kind of like what's happening with the Western diet, right? It's like we're seeing colon cancer explode across the globe, but it's like, why is this happening. So that's amazing how that data is not just being counted towards something that's happening, but counted towards something that can be fixed or repaired and compared elsewhere. So that is absolutely amazing. And so when we talk about data also, we know how some people who are patients who are aware, they're kind of concerned about protection, privacy of their data and where the data is going to be used. Do you find that that's a challenge as well when you're collecting or when you're asking patients about data, that they're concerned as to, like where is this going to lead to, but then also, a way to protect them as well?
Yeah, so in Kenya, and not just in Kenya, across Africa, also right now we have a lot of data laws that are governing disclosure or just handling patient level data. Population-based cancer registries are, especially in Kenya, cancer is reportable. It's a reportable disease. Okay, so that means that the health facility is required to notify all cancer cases to the government and say, these are the cancer cases that we captured this month, and therefore the government is able to make decisions and allocate resources through the National Cancer Institute of Kenya. So, but the data protection laws are a big issue right now because they govern, and that's a good thing for not just the country, but also protects the patient. The patient's data cannot be misused. The patient information and identifiable information is meant to be kept private for purposes of ensuring that the patient is protected at all costs. So that does not prevent cancer registration, especially population-based, hospital-based, pathology-based cancer registries from progressing, because cancer registries ensure that the patient is protected at all times. Sharing of information that is patient level is prohibited, and basically this is understood across board.
That's good, because that means that you can still also collect data, but also protect patient privacy while improving public health need, correct?
Yes.
Okay, good. Because we hear that all the time, especially in the US, like who has access to my data? Who will see my data? How will my data be used? And, and that's a concern for people, right? That privacy. But as you mentioned, it's extremely helpful. And I'm glad that you really shared that, because I hope that our viewers will realize that, this is helpful for them to utilize this information where they do their work, that, it is protected, and, your privacy and this information that we're collecting is imperative to help improve the health, not only for you, but also for others. So I want to talk about, speaking about that, because we know that cancer registry is very important, but what we are also hearing that there's not enough cancer registrars. And so the work that you do, which I found extremely fascinating, the IARC, GICR training, which I'm still going through myself. It's a great module, and it's a lot, as it should be. So your work has helped elevate that registry infrastructure across Africa. What's been your proudest achievement so far in building a registry capacity in the continent?
Well, for me to answer that, I really need to go back a bit and say that in the past, we had to go physically to each country or call them in the cancer registrars in one place to be able to train them. And that was really, really costly. Now we are able to. And then after that, the physical training, after COVID, we had the virtual trainings where the cancer registries will join into a Zoom call and get some training from wherever they are. But now, the GICR IAC e-learning series are the current future of all that, because then a cancer registrar can be able to select the topic that they feel they need to learn more about. And this is free. They're able to go back, go forward in order to understand whatever they need to understand. And then it has some questions that you can ask. I know you have might have been able to look at the challenges and just be able to go back in case you did not understand, or just pause it a little bit to internalize what you need to internalize. So this is the future currently of cancer registration training. It enables the cancer registrar in their own time, because cancer registrars are quite busy. They're most often in the field collecting data. It's sometimes doing cleaning, sometimes doing coding, data entry. It's not easy for them to get the time even out of work. So it enables us as the GICR centers to train our staff and ensure that it has a receipt to it, the certificate. So you can be able to tell if someone actually finished it or not. My proudest moment is this GICR series is when my staff at the National Cancer Institute, 12 of them all completed the GICR e-learnings, the 16 modules. And that was the proudest moment. I felt like my own team has been able to use it. Myself, as one of the people who did some of those modules, I was able to do it. And I know it's not easy. It's not easy. You will see, Candace, it's not easy to complete the 16 modules in terms of time, in terms of just having that time to concentrate and actually learn. So the team of 12, including myself, 13, were able to complete within, I think, few months of its launch. And that was the proudest moment. The other moment was on other cancer registries staff using and utilizing that, especially in sub-Saharan Africa.
Yeah.
For someone to complete 16 modules and show you the certificate, it just means that, one, they're really proud of themselves, because as I said, it's not easy. Two, they're actually dedicated to the cause of being a cancer registrar. I felt like that is one of the reasons why I was born, really, to ensure that this work continues. So I was very proud. I still am very proud, because every day you see people completing. And now I see you interested in the United States. I think in terms of scope, that is quite huge for me.
Oh, that's amazing. I mean, I was floored when I started the research for this Congress, and really looking in to see like who's doing the work, who's in the trenches, because we didn't want to just talk about data. We can talk about data. We wanted to talk about, yes, let's talk about data, but also what's happening, who's moving the needle, what resources are there. And so when I found this, I was like, oh my God, I have got to talk to her. And when I saw all that you did, and then when we talked, I was like, oh my gosh, this is exactly what we want to share and talk about. And then when I saw the module, and I went and I'm still, like I said, I'm still going through it, and I was like, oh my goodness, it just clicked to me that this was something that we needed to share in this Congress for so many other organizations who are in areas where there isn't counting happening, right? They're not collecting data, but they're doing the work. And so if people are doing the work and there is not a cancer registrar in their area, this is going to lead me to my next question. Can people without advanced degrees or who aren't working in that field still take advantage of the training e-series?
Yes, so that's the whole idea. The whole idea is that, there's a lot of restrictions with, you have this diploma, you have this degree, therefore you should or should not do this course. So this course is open to everyone. And my view generally is that anybody can become a cancer registrar, just like anybody can become a cancer patient.
Yeah.
Right? So
Ooh.
anybody can count. As long as you can count, then you can become a cancer registrar. As long as you're dedicated, as long as you are keen to detail, you can become a cancer registrar. Are you interested in becoming a cancer registrar? Then you can do this course and do it well.
That is amazing. I like it. You said as long as you can count. I like that. And and I think, there are a lot of people that are they're like, how can we do this? I mean, there's a lot of NGOs that are they started off in one cancer, but they've found the need in other areas, and they're doing the work, but it's like, but how do we report this back? And so I think this is really great information for those that are watching this video. If they weren't aware of it, I hope that they will take advantage of it. We would definitely share the link to it so that they can register as well. Because I mean, this is so important. It's just heartbreaking hearing stories of visual of seeing things, but like people are not being counted. And I cannot tell you how many stories, that I heard about that. And it's just like, and that's where the dignity comes in, right? It's like, if people are not being counted, then we're missing so many. So,
Yeah.
What would be the ideal vision for the next generation of cancer registrars across the global, about the global world? Like, if our young people are coming up, right, and our young people are more socially conscious now, and so what would that vision of the next generation of registrars look like for you?
Well, we are having more younger, more energetic people coming in, and the situation in our facilities is improving. We are coming from paper-based to a more electronic version for most of the facilities across Africa. So things are generally going to improve. So I think cancer registrars should just be ready to be keen, to just have that keen eye, to notice that, yes, we are collecting here, but what are we missing? To just question the numbers. Is there anything that we are missing? Is this quality of data that we are collecting good enough? Is it high quality based on the standards that have been given? And I must say that at this point, the African Cancer Registry Network, and I don't know if you've heard of the African Cancer Registry Network under Dr. Max Parkin, and the Global Initiative for Cancer Registries, the IARC GICR, Cancer Surveillance Unit, and Professor Freddie Bray, is really keen on that, in ensuring that cancer registrars are more supported than they have been in the past, that the cadre of cancer registrar is recognized by not just the low-level county facilities, but by the governments, ensuring that the cancers are made reportable in most of our countries in Africa, because that is not the situation across Africa. That the policies that are being generated from cancer data are sound, and that the cancer control strategies are implemented across Africa. So I think the future is bright. We have immense support from IAC and Dr. Freddie Bray. We have immense support in cancer registration under African Cancer Registry Network. That is Professor Max Parkin. We also have the IAC hubs in sub-Saharan Africa, in South Africa, under Masvita, in Kenya, and Dr. Anne Korir, where I serve as a co-PI. And then we have one in the French-speaking nation in Cote d'Ivoire. And then we also have established a new cancer hub in the Portuguese-speaking countries, in Angola, to ensure that all cancers are counted across Africa. I think the future is bright, Candace, and the future cancer registrar is going to be happier than the past cancer registrar.
I like that. Can you expound a little bit more on the hubs? I mean, that's amazing. Like, how could people connect with the hubs?
So in the past, we had just the African Cancer Registry Network serving the entire sub-Saharan Africa. But that was a lot of work for the team in the African Cancer Registry Network, led by the coordinator there, Professor Max Parkin. So IAC planned to start regional hubs based on the dialects, English-speaking countries, we have the French-speaking countries, and we have the Portuguese-speaking countries, or based on the role of these hubs. So the one led by Masvita in South Africa is for research and cancer control policy. And the one in Nairobi, head by my PI, Dr. Anne Korir, is for training. Mentorship, and capacity building. So here we train, and we ensure we have mentorship. We ensure we do technical support. for all the countries that need it. So this is easily done by us because we have done it for a long time. So these hubs were selected based on the capacity that was originally there. So, and that is how all the countries, both the French-speaking, English-speaking, Portuguese-speaking countries are able to access quality resources directly from IARC, but through the GICR centers of expertise.
Wow, that is amazing. I mean, it really shows that, the work that you're doing is centered around dignity. And so I will ask this question: what does data dignity mean to you in context of cancer surveillance?
Well, I think there's dignity and there's integrity.
Oh,
And for integrity, it just means for me that this data is good quality, that it is true. If we say we have 1,000 people having cancers of the breast, then that is a true picture, and that it's not 500 or it's not 1,500 people, that we have counted every case, so that it is true. It's whatever it is we are saying, when we count cancer cases, it is true to the best of our knowledge, and that the integrity of the patient is maintained across board from the point of diagnosis to the point of policy, that integrity and the privacy and the confidentiality of this record and is protected to ensure that the patient is the one that actually benefit at the end of all this.
wow. I have to tell you that really gave me chills when you said the integrity, because I don't think that we actually look at it like that. And I think that's such an important, piece to that. And especially when we're talking about the patient, I'm always advocating for treating the whole patient. And just that small piece that you said right there was about integrity. Oh my gosh, that is everything. And so my last question then would be centered around: how do you communicate that um, to funders, to Ministry of Health, to those that, are in a position to help expand this system, that the power of registry data is driving equity and driving dignity and integrity? How do we convince them that it's important to invest in these types of systems?
Well, I must tell you, Candace, that everyone, even the political class, they want all cancers to be counted.
Good.
What they are not doing is allocating resources to ensure that these cancers are counted. So how to convince them? I think taking advantage of the the numbers that we already have. I know as a person, I'm more of a perfectionist. I want to count every cancer before I can say anything about anything. But I'm learning now that even the cancers that have been counted already, as much as they're not complete, they can still tell a story about the cancer situation or the cancer incidence or mortality in the country. So I'm learning that myself, that it doesn't have to be complete yet, because the situation is quite dire. It's not perfect. That is the situation currently. So I'm learning that what can I do with what I have as I wait to get everything that I need. So yeah, so using what is available to just push for the cause, creating a story that they can understand in their level, different levels, different people, different stories, and in a way that they can understand easily. I think that is the way to go in terms of convincing them, because sometimes people are not convinced easily until this cancer is as close to them as possible. So getting survivors, for example, to speak up in these bigger forums, so that they can have a face to it and not see cancer as something that is quite far from them. Hearing the stories of triumph, hearing the stories of suffering as well is important, because we can't hide the scourge that is cancer. So just telling it as it is, for me, is very important. Allowing the true voices of lived experiences to be shared. in all the forums as much as possible.
Wow. First of all, I want to say thank you. You are truly a powerhouse. You are a data collector. You are a disruptor. You are an educator. You are a visionary for the future. And it is important, the work that you do and the voice that you have in this space. And so I want to thank you for your voice, your work, your vision. And we're so grateful for what you have shared and your expertise with us today. And we will make sure that we share the link for the e-learning series for our audience who want to do something and have not been aware, and maybe, for the future of cancer registrars, to even take a look at this e-learning series and jump into the world of cancer registry, because they are needed. And so thank you so much. And I can't wait for us to talk to you on our fireside chat.
Thank you so much, Candace.
Thank you. Hey, are you still hanging with us? I want to thank you so much, Gladys, for sharing the information about the National Cancer Institute and walking us through the global blueprint where structure meets strategy and building equitable registries. So it is poll time. So let's see who among you have heard of the Global Initiative of Cancer Registry, which is GICR for short, program offered by the International Agency for Research on Cancer before. Have you heard of this before? It was new to me. And so I'm hoping that this is something that is bringing a new resource for you. And if you're interested in this, that you will take this course. I'm still taking it, but, just want to encourage you to take a look at it and think amongst yourself whether or not this is something that your organization can utilize. So I'm going to give you about 10 more seconds to finish the poll, but would definitely love to see whether or not this is something that you've heard of, and hopefully you will take advantage of it for free. It is free, $3.99. All right, so let's see what our poll results. Wow. So I'm so glad that we brought a resource that no one has heard of. Well, I won't say no one, but majority of you have not heard from. So this is amazing. So please, 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 when you get the email from us at the end of the conference, we will send you the link so that you can sign up for the Congress.